Hey, good morning. I'm Patricia Murphy. It's Monday. This is Seattle Now. It'll now cost companies $100,000 to sponsor a worker on an H-1B visa. The change has prompted the UW Medical Center and Fred Hutch Cancer Center to pause H-1B visa hires. That's a big problem for healthcare, where doctors and researchers are already in short supply. In a minute, we'll learn more from Seattle Times reporter Nina Shapiro. But first, let's get you caught up. Keep an eye on your mail. You should receive your ballot any day now. Last week, King County Elections mailed ballots to more than 1.4 million registered voters. Turnout for the election is expected to be 45%. And hey, don't miss out. You can register to vote online until October 27th, or even in person as late as 8 p.m. on Election Day. Seattle Congresswoman Pramila Jayapal is hosting a town hall tomorrow night on the federal government shutdown, which has now reached its fourth week. She'll give an update and take questions from the audience during the 90-minute event. It is free and open to the public, but you do have to RSVP. It's being held at the hall at Fauntleroy in West Seattle. Doors open at 5:30. And traffic heads up. The Seahawks are playing Monday Night Football tonight. Kickoff is at 7 p.m. against the Houston Texans, so you might see packed trains and snarled traffic heading toward the stadium district. The Hawks are off to a solid start this season with a record of 4-2. Check back for more headlines on tonight's episode of Seattle Now. The University of Washington Medical Center and Fred Hutch Cancer Center are putting a pause on H-1B visa hires. That's after the Trump administration announced a $100,000 fee last month for employees petitioning the visa. Fred Hutch has been one of the top healthcare sector employers in Washington of H-1B visa holders. Now things are on hold as they look at the steep cost. The fee comes at a time when medical workers are in short supply, and the visa program is one way to find qualified staff. Seattle Times reporter Nina Shapiro is here to talk about what the change in policy means for the local healthcare sector. Nina, good to see you. Thanks for your reporting. Thanks for taking the time.
Thanks for having me on.
So, our region employs a good number of H-1B visa holders, especially considering all the tech companies around here. Can you remind us who this visa is for?
Yeah, so it's for people in specialty occupations, and there's really a range. So what's interesting is that a lot of the conversation typically focuses on tech workers, and that's certainly a really important sector for H-1B, and it's really important for our area. As anybody walking around knows, we have a ton of H-1B folks from all over the world. But what's hasn't been paid attention to as much is that there are all these workers in other critical fields, and healthcare is one of them. And as you mentioned, there is this pretty severe doctor shortage as well as a nurse shortage that's going on in healthcare. Locally, they're estimating that we'll be 6,000 doctors short by 2030. So the H-1B visa has been one way of bringing in doctors and helping to stem that gap.
What's an example of someone who might be hired using an H-1B visa in healthcare, Nina?
One interesting example that I found was up in Tonasket, which is a little town in north central Washington that's near the Canadian border. And a lot of times we think of people being brought in from really far away, from India, from other places, but actually it's used in this case for doctors from Canada. And they're not a lot. It's a small hospital, so right now there's one doctor with an H-1B visa working there, but it's the only general surgeon in that facility. And it's such a small hospital that it has 10 doctors overall. So one of 10 doctors is, someone who is on an H-1B visa. And so they're right in the process of hiring a second person from Canada with this visa, and this $100,000 fee has really kind of thrown a wrench into that process. They think they'll probably go ahead, but it certainly is an obstacle to doing so.
And like we're talking about, this is particularly important for rural areas in our state.
I would say it's important across the board. A lot of times we think of rural healthcare because they're underserved, and that's certainly the case. But anybody in the Seattle area who has tried to get an appointment recently knows it can be really, really hard across the board to get appointments with primary care providers, to get appointments with specialists. I've heard cases of, people with really serious illnesses, with cancer, having to wait weeks or months.
How are medical institutions reacting to the $100,000 fee for visa holders right now?
There's a lot of uncertainty. So as you mentioned, Fred Hutch and the UW have put a pause on applications. The UW did so across the board for all its academic and medical facilities. So that on the medical side, that includes the UW Medical Center and Harborview. And so, together with Fred Hutch, these are three of our preeminent medical institutions in the region. I mean, they're really important. And it applies to clinicians. It also applies to research staff. Now, the UW, they extended their most recent pause until October 15th. It's past October 15th. I last talked to them on October 14th, and they hadn't decided what they were going to do and couldn't tell me if that pause was going to be extended, which I think speaks to the uncertainty right now. And interestingly, they were talking about workarounds and, trying to get creative about other visas they might use or other ways they might apply. One interesting aspect of the proclamation that Trump signed is that it allowed for exemptions for the national interest on a case-by-case basis, right? So that's written into it, but nobody knows what that means because there's no process for applying for that exemption that's been announced. There's no blanket exemption for any specific category, and medical associations have been asking for that. There's been 50 medical associations wrote a letter to the administration asking for a blanket exemption. That hasn't happened. There's a lot of uncertainty about what this is really going to mean as these applications start being approved.
Nina, there are critics of the H-1B visa program who support this latest order. What do they say? Why make it harder to get an H-1B visa?
The argument is that these visas are used to bring in people that will be paid less than American workers, and so it's being used to undercut the American workforce. That may or may not be true. I think, in tech, I have heard some stories that may indicate that people who are being brought in are being paid less. So that is a possibility. What tech folks are saying, and certainly what people in healthcare are saying, is we're not doing this to be exploitative. We're doing this because of the shortages.
Okay, what action are groups taking over the fee, Nina? Are there lawsuits being filed? What's going on?
Yeah, actually, there was just a big lawsuit filed by the National Chamber of Commerce, a huge business group getting in the mix, which is interesting because prior to that, there was just one lawsuit filed in California. And it was interesting who filed the suit because they were smaller groups. There weren't any tech groups involved, which I found really interesting because I don't know if you remember, but when DACA was really heating up in Congress some years ago, the tech companies really got on board with trying to support DACA workers. So it's interesting to me that they didn't hop on board this other lawsuit, and that which was, like I said, smaller groups. There was a nurses group, there was academic union, there were some labor unions. And so I have to wonder whether individual companies are worried about the consequences from the administration, which we know can be quite punitive. And now we have a big business group jumping in, and I suspect that gives individual companies cover.
What are you going to be watching for, Nina, as this new policy rolls out?
I think we're going to wait and see what institutions really end up doing. But I think the other big question in healthcare is a much larger one. Like, what does this mean for the healthcare sector, and how are they going to grapple with these shortages that I think are really affecting patient care?
Yeah, only a need that is going to be increasing in the future, Nina. Seattle Times reporter Nina Shapiro, really appreciate your coverage. Thanks so much.
Thanks for having me.
Appreciate you listening to Seattle Now. Today's episode was produced by Jenny Cecil Moore. It was edited by Andy Hurst. Our production team also includes Caroline Chamberlain Gomez, Vaughn Jones, Brooklyn Jamerson Flowers, and Paige Browning. Greg Kramer does our theme music. Seattle Now and KUOW Public Radio are members of the NPR network. I'm Patricia Murphy. See you soon.